as much as it is a biological drive to sleep, um, sleeping well, it is also a developmental skill. It's one thing at a time, and when you do make the change, be consistent.
Hello, everyone. You're listening to Baby Steps, sponsored by Oxford and Soho Baby, a podcast dedicated to exploring the personal and emotional journeys of parenting. I'm your host. My name is Medea. Today I have Robyn, special needs sleep consultant and mother of two. Robyn, welcome to the show.
Hi, Medea. Thanks for having me.
Of course. So let's get right into it.
Yeah, great.
How much sleep do children actually need at different ages?
So there is kind of a standard guidelines to go, but you'd say somewhere in that range because all children are different, right? All people are different. So for we work at I work I own Sleep Ability Consulting with my partner Brittany, and we typically, we work with clients with children 2 and up. So I would kind of go from 2 years old and older, and so, older toddlers, we want them to get between 11 to 14 hours sleep, including their naps. So that would be including naps, preschoolers, 3 to 5 years old. Uh, 10 to 13, and that's usually when they're kind of slowing down and stopping naps, but those hours include naps usually. And school age, that's like, 5 all the way to 12, we would say, would be 9 to 11. But all kids, like I said, are different, and that's at night sleep. Teens, we want them getting close to the same, 8 to 10. And we do work with young adults as well. And they're still, between 7 and 9 for adults. But everybody's different. It's not hard and fast rules. But we do, you want to try to get to that, at least the low end of that range for most people. It's the teens are hard, even typically developing. They naturally want to stay up later, and that's normal. But sometimes it's just not possible if they have to get up early and be in school, and also we do need to monitor their bedtimes as well. So yeah, we all need good sleep.
Yeah, but sleep is hard to get.
It
It's
can
so
be.
hard.
It can be.
Like waking up in the middle of the night or just being on your phone before bed and that keeps you up. So it's difficult. So I commend you for your profession because it is hard to sleep on your own and get other people to sleep.
We have to prioritize it. I love sleep, and sleep is very important for me as a person and always has been. So I think even before I knew what a sleep coach was, sleep was always, something that was a priority I made it a priority for me. And then when I had kids, that everything, you know, changed, and I had to relearn and just learn in general so much about sleep.
Yeah, what's your most important fact about sleep?
I think I would say that it's important. And as I think we all know it's important. It's just important for so many things, for our overall well-being, for so sleep is foundational. So
Hmm.
it's essential, it's foundational. You need a good night's sleep. So it is important to make it a priority to work on getting a good night's sleep. And for, the population I serve, a lot of our children, young adults have, developmental disabilities in some form or another. And we do try to tell the parents it's not that anybody is doing anything wrong, with trying to have their child sleep. As much as it is a biological drive to sleep, um, sleeping well, it is also a developmental skill that we do have to work on and teach with a lot of our kids. So I think sometimes a lot of parents put it on themselves, like, oh my gosh, what did I do? What didn't I do? Thinking it's just something that's supposed to naturally take place. And that just isn't always how it is. Sometimes you do need the outside help.
Yeah. What kind of, is it like sleep training?
So it would fall under what we do: sleep training, sleep coaching. We are different than a typical. I guess that you would find a typical sleep coach, just in that I think typical sleep coaches focus, a little bit. Typical sleep coaching would be more focused on people with a typical childhood development, right? Where we work with kids, like I said, with neurodevelopmental conditions, additional needs, and they sleep differently for all different reasons. It could be for how their brains work, how their bodies work. So we work with the families typically first. The child's included depending on their developmental level, if they want to be included, if the parents, but with parent coaching more than anything else. It's not any specific kind of sleep training method, I guess. It's kind of a combination of some. And what kind of makes us a little different is we tailor the sleep plan to fit the individual child and the individual family. It's not kind of a set ahead of time sleep plan. We follow some of the same principles, good sleep hygiene and all that, but we do individualize for the child and the family.
How do you come up with a sleep plan?
So that's good. We have a very detailed questionnaire that we provide to the family. We kind of go through it, and based on our experience and our training, we so my background is I'm a registered nurse. My partner is a developmental therapist. So between that and our training in sleep, we come up with a plan to begin. But that plan, that's another way we differ. That plan can change week by week to how the child responds, how the family dynamics work with those changes. So it starts with a very detailed questionnaire about the child and the family and their schedule. Because it's easy to say bedtime has to be, 7 p.m. But if, mom doesn't get home from work until 6:30, brother has lacrosse practice, it doesn't always, we don't live in a perfect world. So we have to make things work the best we can for our families and children.
What are some examples of questions on the questionnaire?
So we do want to know sleep history, right? Because like I said, we work with kids above 2, so we want to know how they slept kind of as an infant. We want to see, any kind of sleep trends. But what's really important for us too is we need to know how the children communicate. Are they verbal, or do they use a device to communicate? We want to know what is the current schedule, not just the current bedtime sleep schedule, but what's their day look like? What kind of therapies are they in? What kind of maybe medications or supplements do they take? So many things can affect sleep kind of outside of what you might just traditionally think of sleep. It's important to know any, additional medical conditions, right? One of the most important things we start off when we speak with a family, even before the questionnaire goes out, um, we want to know about breathing. We want to know, does your child snore? Are
Oh,
they breathing with their mouth open? Is there anything that might signal that there's something maybe medical going on that's affecting your child's sleep? Because we can do all the behavioral interventions out there, but if there's something else going on that needs to be addressed, by a physician, we want that, that's important to be done first. So there's some of it goes on depending on the child, sensory needs, how they regulate, diet, what they're eating, how they're eating. A lot of our children have very restricted diets. So lots of questions. But first, even before would be, we really want to, because we look at the whole child, we really want to make sure there's nothing that would impede our sleep coaching, things that can be helped first.
it seems like everything affects sleep. Is there something
And
that,
sleep affects everything else. Everything affects sleep, and sleep
yes.
affects everything.
Is there something you would say is the most important thing that affects sleep or like the number one thing that affects sleep?
I don't know if there's one thing that I could say that affects sleep universally.
Hmm.
Um, right? I think we, there's different things, maybe timing, especially for children, going down at the right time, and not only going down at the right time, but waking up at having a consistent wake up time. I would say those are very important for children, having the right bedtime. And that's kind of hard to, what is the right bedtime, right? But you kind of want to look at what time we usually have to be up by a certain time in the morning, right? Kids have to get to daycare or school, parents have to get to work, and you kind of see when their natural wake up time is, and then you know how much sleep they probably need. You want to kind of count back from there and look, and that's usually a good bedtime. People hear a lot, parents, about overtiredness. If you're seeing signs of overtiredness in your child, that is typically, not always, because all kids are different, but typically a sign that that bedtime might be too late. We have waited, or if the kids are kind of hyper at bedtime, feeling like they can't settle, that's can typically what we see with our kids is that's the bedtime's too late. We need to start pushing it up. And you can push it up gradually, 15 minutes at a time. So that will usually help with that. So I would say maybe time, timing, bedtime and wake up time.
Okay, that makes sense. Yeah, because you want a routine.
Yeah, routine's very important. And once you get that routine, you want to be consistent. Consistency is huge with everything, right?
Hmm.
With kids and with us, but with sleep, it really makes a big difference. So a lot of times people look up and read and try something that they know may help for sleep, and it doesn't work. We need to give it some time, and we need to be consistent and be doing the same things every day, every night, to really get that going for the child and for the family. Consistency helps the family do the bedtime routine, keep that same schedule every night. And we do, just like we picked this one kind of thing, timing. We do work with by saying, one thing at a time. We don't want to rush in and change everything. One thing at a time.
You mentioned overtiredness.
Yeah.
What are signs of overtiredness in a child?
Typically, what we'll see in overtiredness, some at night, you might see them seem more kind of tired but wired, is kind of
Mm.
a phrase you might see. So they're sleepy, but they can't settle. So a lot of times you'll see that in the evening time, they have a harder time falling asleep. It shouldn't be, an hour in the bedroom trying to get them to settle and rest. By the time you get to the bedtime routine and you're in the room, it should be calm. If they're still kind of hyper, hyper is not always like a great word. Overstimulated may be a better word. They may be overtired. So that is when you'd start kind of trying to see about an earlier bedtime. During the day, overtired, you're going to see they might have a hard time they might wake up too early. They might just be or they might have a hard time waking up in the morning because kids are different, right? So it's just going to be not a kind of gradual, typical wake up. Something's off. But you will see, typically we see they almost seem hyper, more overstimulated when they're overtired, and then kind of like a crash, an afternoon crash sometimes. So they're kind of things to look out for. And you also see with our kids a lot of times behavioral implications of being overtired. And, a lot of the kids we work with, so much of their day is working on things like behavior. So if they're overtired or if they're not getting enough rest in general, how can those behavioral interventions really work the way we want them to
Hmm.
and get a clear picture of behavior if some of the behavior is coming from being overtired?
It's interesting because you'd expect if someone's overtired, they'd be sleepy, but
Yeah.
instead they get hyper.
A lot of them, they appear hyper, right? It's not even that they are, because they might not be hyper in the sense of they're, getting things done and moving purposefully. They just kind of seem overstimulated, might be a better word than hyper, but it might look to the, maybe untrained eye, maybe a little hyper. kind of
Very
bouncing around.
interesting.
Get fidgeting, can't sit still in class, that type of stuff.
Okay, okay. I've definitely
Mhm.
been there.
Yeah.
What would you say is like an ideal bedtime routine for a child?
So I would start off by saying the timing of the bedtime routine. You look at what time you want them to be kind of getting in bed. And you want to make it, especially for the little ones, really 45 minutes to an hour. So I feel like that's kind of first would be timing. I think a lot of people think of we do a bedtime routine, it's we read some stories and we go to bed. So, and this might not be for all children. This specifically for kids with extra needs. We want 45 minutes to an hour. Typical kids, like 45 minutes is still a great bedtime routine length. So bedtime routine, it's good to, as soon as it's time, that hour before bed, we shut off any devices, a bright blue light, LED light. Let's kind of knock that off. Let's get the brain into relaxation mode. And that's kind of a good first way of doing that is knock out the LED, knock out the blue lights, no more screens. One caveat to that is any child that uses a screen as communication, an assistive communication device, AAC, you'll hear if they use that, that's their voice. That is not taken away. You put it in night mode, so it's dimmer, but that's their voice. We're not going to take a person's voice away, but we want that be the beginning of it. Move in, start with your kind of more to less. You want to go ease into the most calming activities as things go along. So, start off maybe a little bit of movement, but calming movement. A lot of our children have kind of a lot of sensory needs. So, a swing, calming toys, maybe some kinetic sands, cars, nothing that's going to, your child, what toys typically get them riled up versus toys that they can relax and be calm with. Coloring, kind of start into something like that. Transition into a lot of children they get washed before bed. So a little bit of family time, a little bit of one-on-one time with the child without any devices, without noise, kind of playing. A lot of kids want their parents in the night. And a great way to help with that is to really give all that time when it's appropriate in the bedtime routine when they're awake. So start off with some nice quality, quiet family time, playing, sensory regulation. Move into the bath time, typically regulating for kids a nice warm shower, a bath. They go to the toilet, go potty, brush teeth, do all the bathroom needs, do it all at one time. So you're not kind of moving place to place to place. And it becomes a nice gradual routine for the child. They are in the family area, move on to the bathroom, move on to the child's bedroom. And that's going to be kind of your final stop of the bedtime routine. Pajamas on, sit in the chair or the rocker together, reads bedtime stories, talk about their day, kind of have a more kind of physical one-on-one time, get that all those needs done, and then tuck in. But not and this is what's hard sometimes with schedules. We don't want to rush that time because then it's the one more drink of water, one more hug, one more snuggle. We want to fill those cups before lights out and before it's time for bed.
That sounds like a perfect routine. I'm like, I need that. But
We all do, right? In perfect world, we would all do it too. But it helps. It doesn't just help the kids; it helps the parents, helps the whole, because they feel like they got their time too. A lot of us are busy. Even it doesn't matter if you're a working parent, working away from the home, working in the home, stay-at-home parent. You always feel you're pulled in so many directions.
mhm.
So, kind of telling yourself you have to do this. This is just a not, the way you have to make a meal and the child has to eat. You have to do this bedtime routine. It sounds daunting sometimes, thinking of 45 minutes, an hour. Who has that time? Once you start doing it, the children love it, but the parents seem to get something out of it too. So,
Yeah, it's quality time, and every
yeah,
parent wants that. Every child wants that.
yes.
Final question. What's your advice for parents listening right now?
To help their child with sleep
Hmm.
in general, I would say a lot of kind of what I already said. So just one thing. Can I give a couple of things?
Yeah, you can give as many as you like.
I think it's important if you're in a place right now where you are you're really struggling. I think the first thing just tell yourself is you're not doing anything wrong. Nobody's doing anything wrong. This isn't always you might hear other people. This isn't always easy. Um, every child is different. Just because your child is struggling with sleep doesn't mean they're doing something wrong, you're doing something wrong. Take a step back from it, kind of take a deep breath. If you need help, if you need advice, ask for it. I think it's important to always just even if you're not expecting anything huge, I think it is important to let your healthcare provider know, even if there is nothing wrong. It's just they're struggling with sleep for some behavior, other things going on. But just in case, maybe there is something, like I said, with the breathing and something like that. I think it is helpful to at least let the physician know, or the provider know, go back and forth. They might have some questions for you that help bring something to light. So, kind of check that off your list, then go in and just like we talked about, those kind of two big things. Timing, we want to look at our bedtime or wake up time. We want to look at our bedtime routine. We want to really make sure it's not rushed. If that means, it's one parent because the other parent's still at work, you have to kind of just look at the whole thing and plan ahead and pick those times based on what your schedules look like. And then just pick one change at a time. You don't have to overhaul your whole system. First, pick the bedtime, then add the story before bed, then lengthen the routine, one thing at a time. Don't overwhelm yourself. This doesn't have, they didn't, a lot of times these sleep problems didn't happen overnight. You can't fix them overnight. So be patient with yourself. Try to work on one thing at a time. And not only that, a lot of what you don't hear about sleep is that it's not 100% night and bedtime. We also want to look at what's going on during the day. I had mentioned wake up time, but we want to look, are they getting outside? Are they getting, not just outside, but fresh air? Are they getting sunlight in the morning? You hear all this melatonin. Our melatonin's released in the dark and it stops in the light. We want to get that light exposure in the morning, even if it can't be natural light, depending on where you live, what time you wake up. Turn the non-LED lights on, make the house brighter in the morning, make the house dimmer and darker in the evening. That supports our natural circadian rhythm. There's so many things, I could go on and on and on about sleep, but I think those are, kind of some main ones, one thing at a time. And when you do make the change, be consistent.
Perfect. I love that. Thank you so much for coming on.
You're so welcome.
And listeners, thank you for tuning in. You've been listening to Baby Steps, sponsored by Oxford and Soho Baby. Have a great rest of your day, everyone.
You've been listening to Baby Steps, sponsored by Oxford and Soho Baby. If you're in the market for a new crib, glider, dresser, or more, we'd love for you to check out our line of furniture. Head over to oxfordbabyandkids.com or sohobaby.com. All links are within the show notes. For more information as a listener, enter the code PODCAST10 for 10% off your total purchase, plus free shipping on all orders over $799. Thanks for listening and tune into our next episode. Bye for now, and remember, every step is a step towards progress. We hope today's story gives you the confidence and the assurance that every journey is different, but we do it together.